Generally, infertility is defined as a failure to achieve a pregnancy after 12 months of a regular unprotected sexual intercourse. And according to this definition, up to 15% of couples do not achieve a pregnancy in the first year, and therefore they're deemed infertile or subfertile. And in half of these infertile couples, there is a male factor involved, and in 25% of these couples, the infertility is purely caused by a male factor. So in a majority of the couples who've not achieved a pregnancy in that first year, often primary care physicians will perform some basic tests for the female partner that will include some blood tests, and for the male partner, a semen analysis, which is generally a straightforward test often performed in fertility clinics. And it looks at several parameters, including sperm concentration, so the number of sperm within a milliliter of the ejaculate, and the quality of sperm, and whether they're motile or not, and several other factors which are very helpful for the urologist who has a special interest in fertility to look at and help guide further investigations and treatment. Generally speaking, there are really no signs or symptoms, and as I've previously alluded to, the majority of these patients are identified once they've failed to achieve a pregnancy and they've had a semen analysis. So performing that semen analysis is crucial and is critical, and because there are really no signs and symptoms of infertility otherwise, apart from in some categories of patients, such as patients who have genetic conditions such as Klinefelter's syndrome, who will have had the condition all their life because they're born with it. It's a genetic condition. They have some typical appearances which one could diagnose those patients from, but unfortunately, because there's not a screening system in place for these patients, even within this subcategory of patients with infertility, the majority of them are diagnosed when, in their adult life, they fail to achieve a pregnancy and they have a semen analysis and they're seen in a fertility clinic by a urologist with special interest in fertility, and subsequently diagnosed with having had this genetic condition, which has several other, health-related consequences as well as the infertility. So in majority of the patients, there won't be any signs or symptoms. So just to give a bit of context about how common the problem is, so in up to 15% of couples, up to 15% of couples will not achieve a pregnancy in the first year, and therefore they're deemed as infertile or subfertile. And 1% of the adult male population is azoospermic, which is a complete absence of sperm in the ejaculate. And in 30% of men with infertility who have a proven abnormality on the semen analysis, a cause is often not found, 30% of them. And historically, these patients were, deemed having idiopathic male infertility. But now there is more evidence, and more experts believe that the majority of these are probably caused by factors such as, environmental pollutions and generation of reactive oxygen species, resulting in sperm DNA damage. Other causes include things like having a varicocele, so dilated blood vessels, dilated veins around the testes, which is more common on the left side, which we think results in excess heat around the testes and therefore can damage the testes and the sperm production mechanism and sperm quality. And other causes include things like obstructive causes, previous surgery, hernia surgery, and some patients who were born with testes that were not quite in the scrotum, and subsequently they had surgery to bring the testes down into the scrotum. once these patients are seen by male fertility specialists, one of the first thing that we need to really identify or make a really good estimate of what might be going on is to work out whether they have failure of sperm production or whether they have failure of sperm delivery, because based on that information, management can be tailored further. So for example, there will be men who don't have, who we think have got failure of sperm production, but that doesn't necessarily mean they don't produce any sperm. And again, we make some attempts to try and identify which are probably not producing any sperm at all. For example, some men who have certain genetic conditions, and from the men who may be producing some sperm within the testes that never makes it out. And those particular patients can have certain microsurgical procedures to try and find sperm within the testes. But then if we can identify the men who will most likely not have any sperm within the testes, then we can spare them an operation, which is unnecessary and obviously can be quite costly. And then the other category of men are those who probably have failure of sperm delivery, so that the testes are producing lots of sperm, but it's just not making it out. The management of those patients are slightly different. So in summary, we identify which categories these patients fall into, and then before undertaking any surgical procedures, either surgical sperm retrieval or reconstructive work, we make every attempt to try and optimize and remove any reversible causes. One of the things that one of my mentors always used to say was that fertility is a biomarker of the male health. So in other words, if a male has infertility, that's likely to be a symptom of another underlying condition. So simply performing a surgical sperm retrieval to get some sperm out is probably not the right thing. So that man should be investigated further, and any reversible causes should be reversed. For example, we know that there are several environmental factors, for example, excess alcohol intake, excess heat to the testes, for example, men who have varicocele, or lifestyle where there is excess heat around the testes, recreational drug intake such as cocaine, marijuana use, anabolic steroids. Some men unknowingly, are put on testosterone replacement, for example, that can affect their fertility. So these are some of the reversible causes which we try and reverse and see if we can naturally make things better before we perform any surgical procedures.